Dear Excellencies, distinguished guests, ladies and gentlemen from social media, Facebook and YouTube. This is Rudranarayan Das, Executive Director, Center for Adivasi Research and Development, welcomes you all to this global digital platform of intellectual gathering of World Human Sciences and Management Conference 2021, organized by Center for Adivasi Research and Development, Odisha, in association with Indian Institute of Management, Sambalpur, and Central University of Odisha, Koraput. The broader theme of this conference is AGNOTOLOGICAL Context, Disciplinary Practices of Social Sciences and Policy Frames. On behalf of Center for Adivasi Research and Development, I extend my profound gratitude to Professor Mahadev Jaiswal, Director, Indian Institute of Management, and Professor Dr. Sharat Kumar Palita, Acting Vice Chancellor, Central University of Odisha, for their support and guidance. The convener of this largest virtual conference are eminent Indian historian, Professor Chandi Prasad Nanda, and eminent policy activist, writer, and philanthropist, Mr. Charudat Panigrahi. Friends, in this evening, we have with us a great intellectual personality, Professor Nancy A. Jennings, from the University of Cincinnati, United States of America. She is going to deliver a web lecture on coping, connecting, and COVID-19. Professor Nancy has pursued her PhD in University of Texas, Austin, and working as an associate professor in the Department of Communication at the University of Cincinnati, United States. She studies the impact of media on the lives of children and their families, and public policies and practices involved with children and media. Thank you, ma'am, for joining with us, and we are very much excited to listen to you. Now, without taking much of time, I would like to invite Professor Jennings to deliver her talk. Over to ma'am.
Wonderful, thank you. So it's a pleasure to be here today, and I'm really excited to talk to you today about children and children's media, coping, connecting, and critical viewing for youth during this global pandemic. So let me see if I can share my screen here. And
yes, please.
Okay, can you see my screen? Oops. Let me actually start that from the beginning instead of the end. Better? So today I'm hoping that we'll be able to talk a bit about how children are coping in using different types of media throughout the pandemic, and what kind of implications that has as we're thinking about the future of children and media, and as we're thinking about kind of this transition from excessive uses of media to a more, perhaps a more well-rounded uses of media. So let us start by thinking about what do children's media look like children's media use look like prior to it's this whole sharing thing, right? Prior to uses of, there we go. Prior to the pandemic. So if we're looking at children's media use, particularly in the United States, prior to COVID-19, there's an organization called Common Sense Media that does several different research studies and reports on children's media use over time. And so they've been collecting this data for a number of years, and they divide it off between younger children between the ages of 0 to 8, and then older children, tweens and teens. And so what they've discovered is that And what the beauty is too is that we have these very contemporary reports that occurred just prior to lockdown, and in particular the younger children, the 0 to 8. This data collection actually stopped in the U.S. when the COVID-19 put everybody into lockdown. So it actually ended in March of 2020. And so what's particularly interesting is really thinking about, what do these patterns look like? What are younger children, what are teens and tweens doing in terms of their media use prior to the pandemic? And we find that younger children are using on average about 2.5 hours per day of screen time. Now, of course, as you see here, it varies by age group. So the youngest children are using less than an hour, but as they get older into 5 and 8, their time use increases. And then also we take them this kind of jump into the tweens and teens. So the tweens actually take over around at age 9. So this is just looking at it as a continuation of child development. And the tweens, they're increasing their media use as well, on average 4 hours, 44 minutes per day. And that's not including homework, and that's not including school. But then also for older adolescents into their teens, we're looking at 7 hours to 22 minutes. So their screen use is gradually increasing from birth up through their teenage years. And we've also seen some pretty consistent patterns of media use by gender. So that in their younger years, we find that boys tend to be using more video games and spending more time with television than girls. And then this just continues and gets kind of augmented as they move into their tween and teen years. And so as we're looking at teens and tweens, the girls themselves are much less likely to say that they engage in video games, and that they are much more likely to enjoy using social media and listening to music than the boys. And it's also interesting to be thinking too, as we think about some of these shifts in different platforms and different types of content, that the younger audience, these 0 to 8-year-olds, their primary form of media, screen media, most of their time spent with screen media is with video. And that makes sense because video is the easiest to comprehend for young children. It doesn't require writing or reading skills. And so it's not as complex, and it's easier for them to use. But what's really interesting is that for the first time, according to this Common Sense Media report, for the first time in 2020, children in this younger age group watched videos online, such as YouTube and the like, more than other platforms, on an average of 39 minutes per day. And that's almost twice as much as children watched videos online in this age group 3 years prior. And like I said, that's prior to the pandemic. So we're starting to see this shift with younger kids away from a television set and more into the handheld and digital YouTube selections, online videos. And similarly, we see this carries through with the teens and the tweens, that they're also using technology, they're using more online videos. And that's the biggest change that we've seen in young people's media habits over time, is that they're not virtual reality and moving into other types of technologies, but really it's the devices, it's the online videos, it's more things like that that they're working through. The other interesting thing too with teens and tweens is that we also see an onset of uses of social media and smartphones. So in 2020, by age 11, the majority of kids have their own smartphone, 53%. And by the age of 12, more than 2/3, 69%, indicate that they already have have a smartphone. And when we start thinking too about their social media use, it's really interesting to think about their social media use, because media age, the first time kids have used social media is on average at the age of 14. Now that sounds reasonable, particularly considering that most terms of service for social media platforms indicate that participants have to be at least 13 years or older to join. However, we also note through this common sense media data collection that that 28% of kids say of teens between the ages of 16 and 18 say that they've already started using social media at age 13 or older or earlier. So they are getting online. They are getting into social media well before what would be typical, what would be the standard terms of service. And the amount of time that they've spent with social media has remained pretty consistent, but it's still about 1 hour and 10 minutes per day. So if we're thinking about this prior to the pandemic, it gives us a lot of question. What is going to happen during the pandemic? We know that there was a huge shift from from school activities and getting out for different interactions outside the home. Now they're all shifting home, and education is becoming online, as well as perhaps other forms of entertainment. So my question kept coming up was what's happening to these kids? How are youth using media during these times? Will there be differences in gender? Will they stay the same? What about youth with different vulnerabilities? So maybe youth that have limited access to the internet. What's going to happen with those folks? And then the other question is also about different vulnerabilities, including chronic illness. So children with chronic illness would be particularly susceptible to COVID-19. And so they might see the world as even more unsafe, and may have implications on their media use as well. And then also really thinking about misinformation and news, because with the pandemic, as with other crises, we really become dependent on the media to share information with us and to encapsulate that information for us. And so how are the kids coping with this? And how are parents coping with use of news and media in their homes with their children? So this led to a variety of different series and a variety of different studies that I've been engaged with, and really happy to be able to share with you today, to be able to talk about what did happen and what are some future implications. So as you would expect, the initial reports during the pandemic indicated that media consumption had increased for adults as well as for children. And honestly, too, as a result, researchers at Qualitative coined the phrase the COVID effect when they were referring to an increase in media use in the first couple of months of COVID-19. And that has even been documented as like up to 130% increase in use of entertainment and social apps, a 50% increase in use of educational apps for kids between the ages of 4 and 15. So, and we were curious if this was just a local phenomenon or if this was an international phenomenon. So I had the pleasure of being involved in a large international study where we looked, we did survey data with over 4,000 children in 42 countries around the world, and with kids between the ages of 9 and 13. And what we found was indeed this COVID effect. The research indicated in the early days of the pandemic that the most frequently used devices or platforms by the 9 to 13-year-olds were television, mobile phones, and YouTube. And as you can see on this graph here. So again, you know, this transition to television, to video content, to devices was prevalent, not only for US kids, but kids around the world. So as we think about, so what was going to happen with, so we got an idea of what the different platforms looked like, but we also wanted to know a little bit more about some of the differences in uses by gender. So we know that there was like this explosion of use, but were they going to stick with their old habits? Were the girls still going to be using social media more than the boys? Were the boys still going to be using video games? And so we conducted a survey of parents in the US of 9 to 13-year-olds. We got about 600 or so parents to respond. And we found that indeed, when we were comparing the girls to the boys, there were significantly more girls than boys that were engaging in social media, or that started social media accounts, particularly TikTok accounts. The patterns that we had observed with gender before the pandemic were maintained. Boys were continuing to play video games a lot, and girls tended to want to watch more videos, listen to music, connect with others through social media. So those were some of the very kind of early days of the pandemic, and we wanted to kind of see. It gave us like some rough numbers of some of those habits, but we wanted to be able to talk, if we could, to the teens and the children themselves and find out what was on their mind and how were they using this media? Because we could see that they were using it more, but was it just for school, or was it for entertainment, or what kinds of functions? And so, grounded in this idea of uses and gratifications theory, the COVID-19 pandemic gave us a means to be able to examine the changes in the dispositional, situational, and social contextual factors that the children were experiencing and the youth were experiencing during the pandemic. So we looked at the gender differences. We were looking for gender differences, but then we were also trying to look a little bit more in depth and look at, how and why were they using these different media forms. And what we found was that with a survey of 14 to 17-year-olds, and these were from teens in both Germany and the United States, we asked them to complete a survey with open-ended responses. And what we found was that the teens were often using media for connection. They were using media for escapism and to overcome boredom. And they were also using it for information seeking. So in terms of connection, teens used media to stay in contact with their peers, which was really important. It was the only way for them to stay in touch with each other was through their media. Teens in both countries reported an increased use of social media, with more than a third indicating an increase in use of WhatsApp in Germany and Snapchat in the US. And while connectivity was possible, for some, it was still lacking in quality. So for instance, like a 17-year-old said that that media was a way to connect, but it was not real connection and it feels fake. So we're kind of seeing a little bit of both a sense of connection, but also like feeling like it's still missing something. Also, so in terms of escapism and overcoming boredom, a lot of the teens were indicating that they wanted to be able to forget. They wanted to ignore the world and to forget. And so for others, media offered an opportunity to do that. So they were using educational they were using the educational services in order to do their homework, but boy, they just wanted to not think about the consequences and the circumstances that they were experiencing. So they were using it as a distraction. One 17-year-old from the US suggested that it provides a distraction from the chaos occurring around me. So again, educational, but then escapism and overcoming boredom. And then lastly, information seeking. So media also provided access to information, which was both helpful, educational, but also at times anxiety inducing. So for instance, we had a 14-year-old girl from Germany saying that she could use media to inform herself about the current situation, while a 17-year-old in the US wrote that media is complete anxiety for her. She says, all I see is the coronavirus or related news, and I just want to hear something good. So for teens, particularly in the US, there were far more teens in the US that found that avoiding the news was a helpful coping strategy, and many more in the US were avoiding news than in Germany. The German teens were not avoiding news as much. So it was kind of interesting thinking about these different uses, like why were kids using it in different ways? How was it helping them cope? And what were some other aspects that we needed to consider with children's use of media? And so one aspect of children's lives that we really wanted to think about was children with chronic health conditions. So this is an important subgroup of young media users, and we really wanted to understand how they were becoming acquainted with their peers and how they would use media as a way to communicate, to entertain themselves, for education and for connection. So we conducted a qualitative study. So again, another part of that series of studies to explore how adolescents with chronic health conditions were coping with the crisis, their primary concerns, and their thoughts about various forms of media during the early days of the COVID-19 stay-at-home orders in the US. So we used data collection through a combination of convenience and snowball sampling, and we got a total of 27 children that took part in the study, 15 boys, 12 girls, from various parts of the United States. And what we found, we focused in different areas. We focused on their worries and their fears. We also focused in their coping strategies and stress, and then their overall media use. And what we found in terms of their worries and fears was kind of interesting, particularly for these children that had chronic illness. So these participants actually expressed a low level of worry overall. And several tweens articulated that their chronic health condition, it did put them at higher risk. They did acknowledge that. But they were also felt like they were doing the right thing, that they were staying home. It was just another disease for me to handle. And they would acknowledge the risk, but they felt safe because they were at home. It doesn't scare me that much, seeing as we're staying in our house the whole time. So they were also drawing comparisons to others that were vulnerable for COVID-19. So for instance, an 11-year-old girl said the elders are at higher risk and I'm at higher risk, but not a lot of children are getting sick or harmed or anything, so I'm okay. So I find that really particularly interesting as we think about how the news coverage of children and who was considered vulnerable at that time. And so we'll talk about news in a little bit, but I just wanted to kind of drop that in there right now for you to start thinking about that. So, so in addition to their worries and fears, we wanted to know how they were coping and what kind of stresses they were engaging with. And so the tweens also shared that they had different ways that they coped and relieved stress during the early days of the pandemic. Though children reported a number of non-media strategies like going outside and playing with their pets and doing different types of things like that, The most frequently reported strategy was using media. So a 10-year-old girl says that she FaceTimes with her friends a lot. They help me if I'm stressing. They're like, you're okay, calm down. So it was another way for her to be able to access her peers, and also to be kind of checking in on peers and seeing how they were doing, and using that energy across the screens to be able to cope and to de-stress. There were others that, particularly these children with chronic illnesses, some of them were missing out on some of their typical activities. So for instance, we have a 10-year-old girl here who talks about how she would have normally gone to a conference where there's other children that also have diabetes, and then they can share and swap stories. So now she's not able to do, she wasn't able to do that during the pandemic, but with Instagram, she was able to talk about her condition, her diabetes, with kids who would have gone to the conference. And they can talk about how they're posting about how to stay safe and how they're coping with the pandemic as well as their own chronic illness. We also have a 12-year-old boy who said somewhat exaggerating a bit, but perhaps it was the truth from his perspective, that he says that, well, I usually play video games. I mean, that usually distracts me, and that screens are mainly what's keeping us alive. So screens are mainly keeping us alive. That's definitely hits home in terms of, you know, how we're able to cope with these differences, and having to be home, having to be in different places that you're not traditionally in. You can't have those types of interactions. And particularly with children that have a chronic health condition, they may be even more constrained on who they can interact with and getting outside the home. Lastly, as we looked at their overall media use for these children with chronic illness, it should be noted that the tweens were very connected. All of them had at least one handheld device, and many of the parents reported that they had a smartphone. The young people expressed both negative and positive observations about their media use during the pandemic. So for example, a few questioned the truthfulness of information that they were receiving about the coronavirus. So again, that's another hint about the news. They were concerned because they said that, you know, the news outlets, they were talking about the exact same subject with the exact same information, but they said completely different things about it, according to an 11-year-old boy. And a 13-year-old boy reports that he tended to avoid media because I don't really want to hear about it, because it makes me sad, and it makes me sad by what's going on around me. I just try and keep away from the media. There were other children, though, who really wanted to know what was going on, and it took a really different approach to the media. So we have, for instance, an 11-year-old girl who observed that I learned that all media is not bad. I learned that not all media is bad. Texting is a form to communicate with your friends, and is one of the only forms right now. So again, you know, they're figuring out different ways to use media to stay connected. They're also being really conscious about what's making them upset and what's making them, what's also giving them support. So if the news was upsetting them, then they could stay away from the news. But if they wanted to reach out to other peers, then they could text, and they could communicate with their friends through text and through social media. So we're talking a little bit about these observations about misinformation. When we talked also with these teens, they were concerned about misinformation. So some of the comments the boys from that had chronic health condition recognized this, particularly in relationship to news coverage. And these youth with chronic health conditions may be more familiar with health communication given their experiences with their chronic illness. And therefore, they may be more inclined to pay particular attention to health information conveyed through the news. So several of the teens then really questioned the truthfulness of the media and of the way that information about the coronavirus was being transmitted to them, was being communicated to them. So for instance, a 13-year-old boy in the US says that the media can be crazy. There are so many mixed opinions about this. And so again, kind of expressing that concern about, are we getting the accurate information? A 16-year-old girl says, I like to watch different news sources to identify the blatant differences and look up the right information. So she's recognizing that there's information out there that may or may not be accurate, and it does make her really want to dig in a little bit deeper and find out, what's accurate and what's not accurate. And then this observation too from an 11-year-old boy that the media, are talking about the exact same subject with the exact same information, but they say completely different things about it. So I find these really interesting from these 11 to 16-year-olds who are looking at the news and looking at information that they're receiving about COVID-19 and really, questioning what, the sources, questioning how the messages are being framed, what's being said about COVID-19. And like I said too, that this may be just really enhanced because they are more sensitive to health information. And so they're paying attention to some of these details. Particularly in the US, they would often refer to the vulnerable populations, and they would refer to vulnerable populations both as older adults, but then they would also mention, these people with these chronic health conditions. And so as children start recognizing themselves as part of that vulnerable population, we really have to think about how they are interpreting that information and how they're interpreting what they're being told about vulnerable populations. So it's as we think about kind of this relationship to media and their resilience and their recovery, we really need to think about, Reineke and Reiger offer a really interesting idea about entertainment media and refer to short-term recovery that can build long-term resilience. So that using media in the short term can be supportive and can be a positive thing, but we also can use this as a terms to build our long-term resilience. But of course, there are negative outcomes that are happening at the same time, and the media can result in some of these negative outcomes, sadness and anxiety, and that those are actually like a form of mood regulation, that it's in resistance to improved mental well-being. And so we have to be cautious. Oftentimes just excessive media use is often associated with these negative outcomes, the sadness and the anxiety and the social comparison with others. But here we are at a time when media use is increasing, and we're actually finding that as a form of recovery and resilience for teens, because that is the only way that they can communicate with the outside world. So again, we have to take a balance that some teens and some children are doing better than others, but we can also recognize that media can be both a tool of resilience building and a source of emptiness and loss. So we need to find that balance. So how do we take this into the future? What are we thinking about some of these implications on future directions? And as we also see surges and more quiet times or lull times of social isolation and the like. So we definitely are seeing more and more screens. And the teens and the tweens are using more and more screens, both to accomplish work activities, and for them, work is school, but also to interact and connect with others. What we really need to think about is kind of beyond how many hours they're spending, but what they're really doing with those types of things. And there is existing research that talks about that addresses some of these issues and really asks us to think if they're using it actively or passively, if they're using it for connection, how they're using it for connection, who they're connecting to. So there's a lot of other implications, and we shouldn't just be looking at the total number of hours that they're spending with screens, but how they're using those screens. And we can look at, by looking at how, that moves us into this notion of resilience and connection and escapism. That oftentimes we use media for different purposes. We use it to build resilience. We use it to connect to others. We use it to connect to stories and to narratives. And then we also use it to escape. When our world is complicated and when our world is a scary place, we all need a time and a space to be able to pull back and have other experiences. And the media can provide that for us as well. So we really need, again, really thinking about the uses, but also the gratifications. What kinds of outcomes are coming from the use of different media forms and media platforms? And then lastly, something that really became obvious to me as I was conducting this research was the need for news for youth. And in particular in the United States. So as I was looking at, particularly with the international study, we were looking across different countries, it became really clear that in several countries around the world, there is news that is produced for kids and for a younger audience. So that type of news really helps explain some of the different contexts and can give more a better, richer understanding of what's happening for kids in a way that they can understand it and they can cope with it. And it also perhaps makes it less scary. And in the US, there's no outlet for that. And so we did see the development of, but again, it kind of tapped into this notion of them going to, the children going to YouTube. So we saw the development of a news program for kids that was only shared on YouTube. It wasn't shared on the broadcast television. It eventually, over time, got shared to some markets, some areas on Saturday mornings. But for the most part, it remains on YouTube for the kids. And it's shorter, it's 15-minute segments. So again, really thinking about how we approach news, how we approach information, and thinking about different vulnerabilities, not just income vulnerabilities or location, digital access, but also children with chronic illness and other types of conditions. So I hope that provides some food for thought for a lively discussion of what's next with children and media. So, so there was, oh, I'm sorry. There's a question in the chat.
I would like to Dr. Nupur Patnaik to go for the quick remarks.
I'm sorry?
Hello, am I audible? Am I clearly audible?
Yes.
Yes.
Yeah, okay. So, very good morning to Professor Nancy, and good evening to the Indian people over here, Indian viewers. So, I think, ma'am, we have a question in the chat box. That's a question. During the pandemic, the corporates are taking advantages to maximize their property in terms of investment in pharmaceutical industries, and how do you look at the state corporate nexus and the role of CSR during the pandemic? And what is the role of media, the fourth pillar of democracy in high times of pandemic, whether it is terrorizing the innocent minds by providing COVID-19 related news, or really working to spread the psychological immunity of people?
Both very good questions. So first, to think about the medical benefits and the cost-effective ways, there is, I believe there is a corporate responsibility in really thinking about how medical supplies are presented, how medical information is presented, and to not show favoritism to one aspect or another. So it's really important to be able to communicate that type of information, but also really be thinking about the ways in which that information is being shared. So we really need to consider how the fear factors associated with it, the hesitancy that individuals might be experiencing in terms of social isolation, but also in terms of digital inequalities, that there are, the digital, it just seems like the pandemic has exacerbated and exaggerated these different types of inequalities on so many different levels. And media and pharmaceuticals are both ways in which we're starting to see that as well. And then the role of the media as a pillar of as the fourth pillar of democracy. I find that particularly interesting as we're thinking about youth. So recently, we had a conversation with media producers for kids, that they were producing news content for kids. And they indicated that they felt like they were kind of fixing, they were going back and fixing some of the scare tactics and the misinformation that children were getting from traditional news, in order to help them better understand COVID-19, better understand some of the different consequences and behaviors. So this psychological immunity really needs to be discussed and really thought of in different ways when we're addressing a child audience. So the role of media can have an impact, and we as researchers can really help them see that, and they hopefully provide means for them to be able to communicate in a better way.
Thank you so much, madam, for wonderful delivery, and you talked very well about how media and teenagers, how media impact on teenagers and about child education. I briefly and sometimes felt that I was in a mind institution, right, madam? The child mind institution. Perhaps I would like to know more, and you take these are questions or even submission as well. I want to know more about the media education. how the pedagogical practitioners and the media educators in the particular crisis of this pandemic. And can you, madam, brief some more about how the impact of teenagers? Just like I would like to share some of examples about Facebook, YouTube, Instagram, and Twitter as well. When the teenagers, particular 4 to 10 years old, they watching it, they feel nervous, and also they feel innocently, tactfully not managing all these things. In terms of their body language is very ill, and they are sophisticated, and they felt very depressive. What is your ideas on it, madam?
Okay. Yes. So there, I feel like there is opportunity for them to feel more like it's their medium, it's their message, and it's about their activism. So it's really important for them, as we think about media education, that this notion of social comparison with media is pretty critical. And how is information being spread, and what types of information is being spread, and how can they find joy again with their media use? And I think that was really an interesting aspect that we talked about this summer. So this past summer, I collaborated with some colleagues about developing a media literacy curriculum that focused on joy and focused on identity, and really helped them think through because I feel like the pandemic has really been having us question our own identity and our own sense of self and others, and how can we believe and trust in others. And so that, thinking about how, who's telling our story and how that story is being told is incredibly important and can be incredibly empowering. And so that has been the focus of our curriculum, in thinking about empowering the children and empowering youth about telling their story.
Yeah, thank you so much, madam. And when you talked about the impact of media on youths, particular the US youths, and particular I could know from you, what about the youths of India as well? From V square, vaccination to virus, right? And then people called it's purely depend on the marketing strategies of the West and impose on rest, right? And then the pandemic as well, how connectivity and outreaching, contracting, and all these communicating, how could it possible in a very sustainability of future when we looking forward and compare with the Spanish virus as well with the Chinese virus, or what we call it, the pandemic as well, or COVID-19? Do you feel media is doing very visible job in the particular virus to vaccine?
Yes, there definitely does seem to be a strong bias, and there's a lot of I feel a lot of concern about that. We really need to, and I guess that goes back to what my news producers that were working with children's media. A little feedback there. Were indicating that they felt their job was to go back and fix some of that. So really thinking about, but if the kids aren't getting that, and that they're just getting this constant misinformation, then there's a lot of concern to that. And how do we address that? And so that comes into the parents and teachers and caregivers, big people who care about little people, and really thinking about how we can make a better society for them. So there are, but it does relate to policy too, right? So can we make policy that encourages news for kids, or that encourages funding to support media literacy? because those are important aspects as well. And we can't leave it all to the parents to make, they've got a lot on their hands. So we can't just leave it to them either.
Thank you so much, madam. And my last question for you, if time permits. Okay. As social science is concerned and social psychology is concerned, how media is doing a middleman kind of job. If we believe in the Habermas theory, what the Frankfurtian school founder said, content first or community first. When you look seriously upon these media jargons and in particular how media is doing all these things in terms of corporate world and particular in terms of the US market and the Chinese market. Now these countries are really doing very fascinating ways of transferring ideas in terms of just change the power, how to become the superpower is concerned. How do you feel? What is the actual role of media? Rather, they could sell the idea of terror, or they could sell the idea of how to save our civilization as fast. If you do agree with my concerns, then what Habermas said, the public sphere. Do you believe the public sphere have any pace in this pandemic time, the crisis and the pending world is concerned about? And he said another thing, the public ideas is concerned. What is your ideas on particular these holistic nature and this holistic perspective of media is concerned? Because when we are the students of media, when we are in universities, we read something different about media. It's really the fourth pillar of the democracy. But here is I seriously concerning about these issues. I don't believe media is anymore as a fourth pillar of the democracy. It is very genuine and very corporatizing and very glamorized world to represent all the jargons and or the very brief related to how to do more and more profit. Please tell me some of your brief ideas, madam. Thank you.
Certainly. So I agree with you. I have concerns about the corporatization of media, and so what messages are being reinforced through that corporate model, and what messages are being omitted, overlooked, reframed, those types of things, and that is very concerning. And I feel like the notion of YouTube and social media, that was supposed to be like the salvation, to give everybody a chance to have a voice and to have that voice be shared by thousands, by millions around the world. But more recently, there also seems to be that it can be manipulated. It can be used as a means to spread misinformation, as a means to polarize individuals, to spread corporate missions rather than community missions. And as it relates to the public sphere, I do have concerns about limiting social media in different regions, to be able, because that seems to be one of the ways in which information is being transmitted kind of around some of the corporate factors. And again, this notion of media education, that needs to be critical. What is the truth? What is being valued? And can we teach our children, but also our adults, to be able to recognize that corporate bias, to be able to recognize the corporate messages. So I like to be a little optimistic that we can get there, but it needs support, and it needs care.
Thank you so much. Thank you so much.
Okay, ma'am.
Thank you, Dr. Jenna. There is a question in the chat box. I'd like to read it. Ma'am, the question is, what is the increasing role of mass media to deal with infodemic and fake news?
Oh, good question. So the infodemic and fake news is a grave concern. The media does, I feel like the media does need to take responsibility for their ability to be able to shape the message, their ability to be able to frame the message, and how they're sharing that information with others. And so we really need to make them accountable for the types of information that they're sharing. And so also, thinking about fake news and thinking about in terms of social media, where they're blocking individuals who are sharing misinformation. I think that's an adequate and an appropriate response. That there does need to be some type of a blockage, some type of a means to be able to stop misinformation from happening, but also to put emphasis on correcting misinformation, and to indicate, this may be something that you've heard, but let me tell you, what other sources are saying. So I think it's important, to hear lots of different opinions and lots of different information, but to really get back down to the science and be really thinking about the veracity, the truthfulness of the information that's being shared.
Thank you, ma'am. Now, I would like to invite Dr. Nupur Patnaik to go for a quick remark on Professor Nancy's talk. Over to Dr. Nupur.
Okay, thank you so much, Dr. Rudra. First of all, I would like to thank Professor Nancy from coming all the way from University of Cincinnati, USA. Ma'am, you have given about your topic on coping, connecting, and critical viewing youth and media in COVID-19. So you have, ma'am, very nicely putted certain points to the forefront, and it's really needed as we have a large audience through the YouTube and through the Facebook. Many are listening to you. So, ma'am, you have elaborated about the social media and its use. Basically, from the very first half, you have described about the gender aspects within that, how men or boys, we can say teenager are more prone, basically the boys, they are more prone to video games, and they are more into this technology, screen friendly, because COVID pandemic made a collapse of the healthcare system, and that led people to seek help with the social media. And that was the reason that many people, they got into, many small kids, teenagers, they went into the screen timings and they spent their timings within the screen only. And that led a huge impact. And secondly, ma'am, you said about that how could people cope with this particular thing, and how it's there are some positive observations as well as some negative observations that you have given. And it was really very awareing for all the people over here, because everybody should know that how we should not spend totally the time on the screen, and we should do something other than that, because it also had some drawbacks. So that is what, ma'am, you have said it. It was really great listening to you. And another thing, ma'am, you said, how could we develop this resilience practices through different steps that you have said us. I think, ma'am, everybody could have got awareness over here and sensitization over here. So thank you so much, ma'am, for coming here and enlightening us on such a difficult or of a very ongoing issue that comes here. So thank you so much, ma'am. And another question I have, ma'am, for you. The question is that I wanted to ask you, ma'am, there are many people like in other countries, people have this thing, but there are many countries where they don't have access to this digital things. Like there are many digital divides that goes on, not only in education, there are many students who are left out, who don't have that particular thing to get into. So ma'am, could you please suggest something that what could we, how could we bridge this particular thing and how could we come to a solution? And thank you so much, ma'am, for your enlightening viewpoint over here.
Great, thank you. Yes, the digital divide is still real, and it still exists, and it's definitely not going away at any blistering pace. So that is particularly concerning. And we need to think about like public policy to be able to make that access possible. We need to think about how can we get connectivity to individuals? And there's been a large discussion about, why are we paying fees for all these different services? And that these fees are making it difficult for individuals to be able to have open access and be able to have information. And so I believe that that's, for me, that's one of the ways in which we can move forward, and really thinking about it as a utility and as something that everybody should be have access to, and not just those who can afford it.
Okay, thank you so much, ma'am.
Thank you.
Thank you, Dr. Nupur. Now we have to be concluded this session. Thank you, Professor Nancy, for joining with us and sharing your thoughts on the present scenario. We are highly appreciated your talk. Personally, I had gone through your book, The Twin Girls and Their Medicated Friends of 2014. It is a very good piece of book. That and another your co-edited book, The 20 Questions About Youth and the Media, with Professor Mazzarella, is quite interesting. And the several topics that you are researching and providing to this academia is quite interesting and important. And in these pandemic days, definitely it will be very meaningful for the society in India. Definitely your research and your books are going for a major impact on our society. And thank you so much for joining us. Kind-heartedly, we are thankful to you from the side of Center for ADIVASI Research and Development and Indian Institute of Management and Central University of Odisha. Thank you so much, ma'am. Now I would like to conclude the session with thanking the Vice Chancellor of the Central University of Odisha, Professor Sharat Kumar Palita, and the Director of Indian Institute of Management, Dr. Mahadev Jaiswal, and the Director of Center for ADIVASI Research and Development, Dr. Bikram Kesri, and all our audiences from social media like Facebook, YouTube, and Instagram. Thank you all participants, researchers, students, and academicians, and our team, Professor Shubham Das, Dr. Nupur Patnaik, Dr. Samuel Lima, Dr. Kamal Prasad Mahanti, and Dr. Ghanashyam Giri for their cooperation to organizing these kind of intellectual gatherings. Thank you all. The meeting is concluded. Thank you, ma'am. Namaste.
Thank you so much, madam. I'm looking forward for future engagement also. Thank you so much.